lecture I had 2 weeks ago, I commented that there are people far beyond here who are eagerly waiting every week or every other week to get the new thing that we're expressing through this medium. And thanks to the ICT team, thanks to them, really, I must commend the young men who are working because they are really doing well to broadcast this effectively on YouTube, Facebook, various social media handles. Our inaugural lecture have been broadcast, and people are getting. And I believe today will not be an exception. As I said, there are realities in our times where we need to be cautious. We need to learn about schizophrenics. It's a current reality. So it's for everybody. It's for the town. It's for the gown to learn today. And it's no mean professor. This great professor of clinical psychology who was trained in the Philippines and practiced extensively in Nigeria and has worked with many persons. I believe that the masquerade that we're unveiling today is a very big masquerade that we'll be proud of, as usual. So on this note, I want to thank all of us for finding time to be here and thank our online audience especially. They are so massive, very large. When I had the privilege of knowing the number of persons who are doing it, I was so elated. I was so elated. So I thank all of you for keeping faith and the friends of our great professor, Rita Ugokwe. I want to thank all of you so much for all that you are doing. And importantly, I want to say this in conclusion that psychology department, honestly, as within the past few years of my administration, they have been actively contributing to our overall worldview. So I must say there's special applause for psychology department. And by extension, Faculty of Social Sciences. So, that's what they say in Igbo. If you are doing well, you hold it well. So keep it up, and I look forward to a very interesting time this afternoon. Thank you all, and God bless you.
A more resounding applause would be appreciated. Thank you. May I use this opportunity to recognize the presence of Professor Dom Wankwo, the HOD, Chukwemeka Odumegwu Ojukwu University's Psychology Department. Thank you, thank you, thank you. Actually, what the Vice Chancellor was, in measured tones, trying to impact on us is that very soon, I got my 9 and Dalabi. 9 are for her every day. Manananyama on a Chineke na Zoani. Maketa alone a dokakwa. Professor Ugokwe-Joseph, Rita, will tell us. But I sincerely hope that after this lecture, I will not grow paranoid. But in reality, just like the Vice Chancellor has said, we have swallowed, supposedly, with enough shock absorber, enough stress in this country to pretend that we are okay, but we are not okay. Let me not preempt the lecturer. But before she comes up, a flutist calls up a masquerade. So let me call up your flutist in the person of Dr. Valentine Uchagu to read your citation. Dr. Valentine, thank you.
May I invite the inaugural lecturer to mount the podium for the citation. Please. The inaugural lecturer, please. Yeah. The Vice Chancellor, Professor Charles Ukechukwu-Simone Ulukanachukwu, Fellow Academy of Science, distinguished professors, members of the academia, guests, physical and hybrid, ladies and gentlemen. Citation of Professor Rita Ugokwe-Joseph of the Department of Psychology, Nnamdi Azikiwe University, Awka, as the 66th Inaugural Lecturer of Nnamdi Azikiwe University here at Migration Center this day, 2nd December 2021, in the year of the Lord. If there is something that has intrigued the minds of men and scholars, beginning from ancient Greek philosophers to the present day, it is understanding and describing the human person. Citation is in no way short of this, particularly when given limited time to do so, as the son of Woko has already told me. So I will do my best to be as fast as possible. Vice Chancellor, sir, we're about to hear from the Commander-in-Chief of Intelligentsia in Clinical Psychology, a professor of international standard, and an Asian-trained clinical psychologist. The professor we are to hear from today is a psychoanalyzed psychoanalyst, a research scientist, and the pride of clinical psychology in Nigeria. I'm talking about the clinical psychologist who, though not a schizophrenia, listens and understands the language of schizophrenics, a scholar par excellence, and a wonderful mentor. Prof. Ugokwe-Joseph Rita was born December 28, 1959, to the family of late Chief Joseph and Christian Ugokwe of Umota village in Idemili North local government area of Anambra State. She did her primary school education at Shuke Memorial Primary School, and then the secondary school education at Community Secondary School Obosi, and finally completed that at Girls Secondary School Agolo. Prof. Ugokwe-Joseph Rita completed her secondary school and sat for secondary school certificate education in the year 1977. Due to her love for teaching and mentoring, she registered and trained at Teachers Training College Obunike between 1978 and 1979. Then proceeded for bachelor's degree at the first women university in Asia, the prestigious Philippines Women University, Manila, where she graduated with honors in banking and finance economics option between 1981 to 1984, and studied for a diploma in psychology in 1985. In 1986, she was awarded a master's degree in banking and finance economics option, and in 1987 was awarded another master's degree in clinical psychology from Manuel L. Quezon University, Philippines. In 1989, Prof. Ugokwe-Joseph was awarded a doctorate degree in psychology, clinical psychology, special focus on clinical psychology from Manuel L. Quezon University, the Philippines. Between 1989 and to 1991, she did a 2-year postdoctoral fellowship at the research wing of the Psychodynamic System Research and Planning Center, Quezon City, Philippines, where she was engaged in evaluating the empirical efficacy of Freudian psychoanalysis in neurotic patients. Between 1991 to 1993, she studied a residency training in Freudian and Jungian psychoanalysis under the supervision of a Vienna-trained psychoanalyst, later transferred that to Japan. In the tradition of the Freudian psychoanalysis, Professor Ugokwe-Joseph Rita had to undergo psychoanalysis herself while lying on the couch of old Freudian analysis as part of the training for being a psychoanalyst, a rare opportunity now. Mr. Vice Chancellor, sir, today's inaugural lecturer was well prepared on her journey towards being a psychologist. May I briefly state some of her pre- and postdoctoral experiences to drive this point home? Between 1986 and 1987, she was a clinical intern at the Armed Forces of the Philippines Medical Center, Neuropsychiatric Section. From 1987 to 1988, she was also a pre-doctoral clinical intern at the National Center for Mental Health, formerly known as the Philippine Mental Health at Mandaluyong 4. The soldiers. Following her postdoctoral and residency training in psychoanalysis, she was appointed a consulting psychologist at Home Care Clinic and Hospital from 1993 to 1994, and at the same was moonlighting for the Rema Counseling Ministry as consulting psychologist. From 1994 to 1997, he was appointed chief psychologist of the Rema Counseling Ministry that oversees to the psychological treatment of children and adolescents at risk for psychiatric disorders. She then founded the Rema Parent Group Counseling that oversees for troubled parents. While at Rema for Counseling Services, this professor was the chief clinical psychologist at Jimenez Neuropsychiatric Training Center and Mental Hygiene Clinics between 1994 to 1998. Professor Ugokwe-Joseph Rita was an ardent teacher that rose from primary school teaching to a university professor. Before leaving Nigeria for university education, she was a primary school teacher between 1979 and 1982 at Central School Opion Nsukka in the present Enugu State, Nigeria. Following her doctorate education, She lectured at the International University, Missouri, Manila campus between 1989 to 1994. Returning to Nigeria, she did her mandatory NYSC with the Department of Psychology, Nnamdi Azikiwe University, between 1999 to 2000, then as a corporate lecturer. After her youth service, her services as a lecturer in the department was retained by the then university management, headed by Professor Peter Ejiofor, under the deanship of Professor Christian Weke and headship of Charles Anazong. From year 2000 to date, Professor Ugokwe-Joseph has been a lecturer in the Department of Psychology. She was promoted to the rank of professor in the year 2014. Professor Ugokwe-Joseph Rita has had many awards and honors to her credit. She was awarded state and national NYSC awards for her meritorious service during her service year. She picked 5 vagrant psychotics from 2 markets in Anambra State and successfully rehabilitated them for occupational engagements. She was given Alumnus Award of Excellence Accomplishment in the field of behavioral medicine, in the field of behavioral science, and promotion of the university ideal by Emmanuel L. Kizon University. So many other awards has been given to her, but have to speak for the want of time. Vice Chancellor, sir, Professor Ugokwe-Joseph has presented papers and talks locally and internationally in a very many prestigious universities in Asia, Europe, and Sub-Saharan Africa. She's a fellow and member of the professional associations, including fellow of the Nigerian Psychological Association, fellow Royal Institute of Psychology, Singapore, fellow Strategic Institute for Natural Resources and Human Development. As a psychologist, she is a member of Nigerian Psychological Association, American Psychological Association, Nigerian Association of Clinical Psychologists, member of the Philippine Psychological Association, member of the Philippine Mental Health Association, and then member Social Science Association of the Philippines. This distinguished scholar has successfully supervised 12 doctorate candidates, both at Nnamdi Azikiwe University and Imo State University, and over 19 master's candidates. She has over 40 journal articles published in reputable journals and 14 books and book chapters. She was the first psychologist in Nigeria to write an introductory text on Rorschach test and interpretation. This is a rare projective technique for understanding human unconscious behavior. Professor Ugokwe-Joseph has attended and facilitated over 25 workshops in psychology, locally and international. She intermittently leads a workshop on fundamentals of hypnotherapy for anxiety and pain management for Philippine Psychological Association and has served severally as a resource person on this issue. She has served at various capacities within the university. She was a member of the University Guidance and Counseling Committee from 2007 to 2011 and later became the chairman between 2016 to 2017. She has had so many membership committees. She has harbored at the Faculty of Social Sciences and on administrative services, which I will not forget was the past immediate dean, Faculty of Social Sciences, Nnamdi Azikiwe University. On administrative service outside the university, Professor Ugokwe-Joseph was founding director, Psychiatric Rehabilitation Center, Obosi, and the first of its kind in Southeast Nigeria as an inpatient private rehabilitation center. She was the founding director, Royal Institute of Psychology, Psychometric and Research Services in Nigeria, and consulting board for Somadina Challenge Foundation for children at risk for mental retardation. Among other consulting services, this professor was among the top national consultants for the 4th Eminent and Expert Group Meeting organized in 2016 by National Institute for Policy and Strategic Studies, KURU, to discuss the issues of national integration, particularly drug addiction in adolescents. She was among top Nigerian psychologists consulted by the Senate House Committee on Public Hearing for bill to establish Nigerian Council for Psychologists and Related Matters in 2018. Presently, Professor Ugokwe-Joseph is moving her attention to Alzheimer's and dementia studies. She is the founding director of the Research Center for Aging, Cognition, and Psychological Health, Nnamdi Azikiwe University. Her interest now is on finding affordable biomarkers for early detection of Alzheimer's disease and related dementia. Professor Ugokwe-Joseph is a scholar that weaves her professional activities with social life. She's married and blessed with 3 children. My Vice Chancellor, there are many more to say about this great psychologist, but for the want of time, may I conclude by emphasizing on the empathic, altruistic, and ever cheerful nature of this professor, who smiles all the time. Indeed, whenever I see her, the sayings that those whose kernels were cracked by benevolent gods shall always remain grateful do come to mind. Indeed, Prof. Ugokwe-Joseph success story point to persons whose kernel were cracked by the benevolent gods. Our own vice chancellors are distinguished academics. Guests, may I request your honor to call upon this erudite scholar of psychology, the teacher of human behavior, and accomplished research scientist to mount the podium to pontificate in usual university tradition. Thanks and God bless.
One more. One more. My dear Vice Chancellor, our professors and members of this audience, please allow me to stand on the existing protocol since time is against us. Am I allowed? No. It is my joy to say something about schizophrenia. Schizophrenia is not the only behavioral problem we have, but I chose decades of living with schizophrenia, schizophrenics, lessons, and insights in order for us to learn more about the future, as the Vice Chancellor said. Looking at the picture, in the drawing, in the television, you can see somebody like you and I, the inside body projected as a human being that you are with. You may not know what he will do next. Things that are going into his mind. The write-up of this very person that is analyzed as a schizophrenia and is also depicted in order for us to see the inner person of the person you may be staying with. For over 3 decades spent studying and rehabilitating schizophrenia will remain part of my joy and life. Part of my joy and life as a scientist and professional psychologist. It does not only remain part of my joy and life, it taught me human life, man, life, and meaning to life. It's not just how we look and see things are the way it is. They are inner persons that are managing our lives. As I said, I came to understand that in every brain, there is wise and foolish corners. These wise and foolish corners brings ups and downs in our life. And if not well managed, it will not bring peaceful coexistence. As it will not bring peaceful coexistence, people will begin to quarrel everywhere. There will be no peace. My topic is divided into 2. First, on my journey into the science and practice of schizophrenia. And second, about schizophrenia, the lesson and insights following 37 years of research and practice. On my going to the Philippines, on my traveling to the Philippines, my intention was to study banking and finance and economics as master's degree. But when we arrived Philippine Women University that gave me admission, they said we are going to undergo career evaluation. And undergoing career evaluation, that our career evaluation is going to match with our interests. I completed banking and finance first degree and master's degree and wrote on management of rural banks in the Philippines in my master's thesis. On writing on this, I hope I was to be a banker. But the pressure from Philippine Women University on changing my course out of the result of, excuse me, out of the result of the professional counseling and also career evaluation. It was said that I had to take, that I fall into behavioral medicine. I could not accommodate this. Vehemently, I refused that I will not take that. That my parents told me that I will study banking and finance. And on studying banking and finance, that I will study economics. It was a battle. I refused. That I don't know what an aptitude test is and what I'm here to take. What I was there to take is psychology. Eventually, the university, because of my persistence, told me, they put a clause that I will take diploma in psychology before graduating in banking and finance. I agreed and decided to take the diploma and also my banking and finance. Immediately after my graduation, I left the university to another university because I didn't want to be distracted. I know a bank by my father's house where I suppose that I will work. I know of doctors, I know of other people, but I did not know anything about this psychology. When I left to that very university, I got myself enrolled in economics. Unfortunately, Philippines has a body that is called DEX, Department of Education, Culture and Sports, where you get your study permit to continue with your education. When the study permit, I went to apply for the study permit. They told me that I should go back to Philippine Women University and complete my baccalaureate graduation. That is convocation. When I went for the convocation, I was given a letter to the chancellor of Emmanuel Kazan University and also for DEX, Department of Education and Culture. When I presented the letter to them, they said that I should go and enroll in Masters in Psychology. I refused, that I will not enroll in Masters in Psychology, that I don't know what it is. With the letter I was crying about, I went to the embassy and complained. After looking at the whole thing, you know how we Nigerians are developed. Well, everybody will be pitying me. Eventually, I went to the Dean of School of Postgraduate Studies. The Dean sat down with me and asked me what the problem was all about. I explained. She said that I should sit down. Let the secretary give me a cup of coffee. I was drinking the cup of coffee while she left. On coming back, she said, Rita, I thought I was successful. She came and told me that now we have accepted you will take economics free of charge. Don't pay your school fees. And in your master's in psychology, you will pay your school fees. I never knew they were luring me to where if I put heads up again, they will deny me their scholarship. Then I said, okay, I continued. As I continued, I enrolled. And upon enrollment, I continued. The first picture you can see is a picture where I graduated in my first degree. In that graduation in my first degree, it was a problem because a slogan was given to all of us. And that slogan, my own slogan, was that a best educated human being is one who understands the life, who understands most the life he is placed. I don't know the meaning of this very statement there. The best educated human being is the one who understands most the life he is placed. I don't know where I was placed. The other is moving to psychology. When I finished my PhD in psychology. Actually, I left abroad at the age of 22. And everything was fast, because abroad, they didn't want to waste your time. We continue in the study of psychology. As I enrolled, a mentor, an academic advisor was introduced to me. They told me to go and meet a man called Pa Odonyes after the diploma for me to enroll in master's in psychology. So I finished master's PhD and went for postdoctorate education, like was cited. Pa Odonyes is a lover of scholar. She loves scholarship. Love replicating himself. Love replicating himself in another person, and love for scholarship. And love for scholarship. Immediately, Pa Odonyes said, we are going to be going to the National Mental Hospital for psychological testing, analysis of issues concerning mental disorder. It was surprising to me. I didn't know what to do, but I had to follow. As we continue to go, every morning about 8 o'clock, because class starts there 7:30, I will move to go and wait for Pa Odonyes in Psychiatric Rehabilitation Center of the Philippines, then called Mandaluyong, the National Psychiatric Hospital. We continued. As we continue to go, to give tests, to evaluate. And under my evaluation, I have what they call top clinicians that are training me. I have a psychiatrist, a PhD clinical psychologist with experience. I have a social worker. Pa Odonyes was my academic advisor. Shortly after our going to National Center for Mental Health, Pa Odonyes said that I have a creative intelligence and I can analyze things easily, and said we will be going to Armed Forces of the Philippines Psychiatric Center. I was so frustrated. I didn't want to follow that. I would be telling Pa Odonyes that I'm supposed to be reading my books. And Pa Odonyes told me that I should bear in mind that practical expertise is far better foundation than theoretical background based on haughty ignorance. I said, sir, I said that practical expertise is far better foundation than theoretical background based on haughty ignorance. I didn't know what to say. He further said that it's good for me to follow his mentorship, assignments, direction with humility, and to shun rebellious attitude in mentor-mentee relationship. It's like as if I was held in the neck. I didn't know what to do, but I have to follow. I have to follow. Why I'm laughing is that the day he asked me to follow with humility was that I was coming and he was coming, and he knows that I'm rebelling. I was singing, follow, follow, I will follow Jesus anywhere, everywhere. I will follow on. Okay, I never knew that being a clinician he is, that he was monitoring my mood, my reaction, and everything. And he is not a clinician to be toyed with, because he was respected all over Philippines, and he studied in Harvard, and the pride of Harvard. And sometimes he will call me Rita. I will say, sir, I hope you are going to represent me in Africa. I think represent you in Africa, because you know me before. I will say, okay, sir. Okay, sir. I will do so, sir. As we continued, I came to the end of my master's degree after 42 academic units of classroom work. when you talk of psychology, Philippines will drag you about. Philippines will position you in such a way that nobody will tap your back. After 42 credit units of classroom work and visitation of the hospitals, I decided to write my master's thesis on adjustment problems of Nigerian students in Philippines, Metro Manila universities. Why? Because in our interviews and going from pavilion to pavilion, I saw that from my interview that the problem people have is problem of adjustment with issues of life. And if only we can adjust well, like I said, we have wise and foolish corners that brings ups and downs in life. And if not well managed, we cannot live in peaceful coexistence. We continue on after my defense of my master's degree. Pa Odonyes, in a fatherly way, called me Rita, as I was rejoicing that I'm going. It's good you have your PhD. Tomorrow you will regret it if you don't have your PhD. It is good to have it when you are hot and when it is hot. If you don't have it now, you will regret. I had mine when I was age 28. You better work hard. After looking at Pa Odonyes and his humility and love on telling me this and ready to enroll me with his money, I said, okay, sir. Pa Odonyes enrolled me in doctorate degree. As he enrolled me in doctorate degree, he started assigning to me personal cases for diagnosis and for management. And in one of those days, I packed the test he gave me and said that I'm tired of all these things. Pa Odonyes said, Rita, let me tell you, as a stethoscope is in the hands of a physician, so is a psychological test in the hands of a psychologist. If you cannot diagnose, treat here in the Philippines, don't think you will do well in Nigeria. We continued. He started introducing me with his top clinicians, the psychiatrists and the clinical psychologists, to their homes for me to be working while doing my PhD. And in PhD, I still have 60 classroom units to face. I continue to face that. The picture before you is one of the group counseling or group therapy we have in National Center for Mental Health. As this continues, I kept toiling. It was toiling for me. It wasn't easy, but I started loving psychology because I started finding out things that are disturbing people, the problem people have in everyday life, why people behave the way they do, the mental processes. And when I talk of the mental processes and reason why people behave the way they do, they will tell me that I'm bringing, maybe I have African magic. I ask them if they are discussing of African magic here. But they will tell me, no, we are pulling your legs. And as we continue, I kept learning. As I said that I was rehabilitated, there was a day I told my boss, a psychiatrist, the owner of Estrella's Home Care, Camias, that we don't eat dog in our place. That if we eat dog will give you rashes in your mouth. Alex Estrella said, is that so? I said, yes, that we don't eat dog. There is a dog called Douglas, so much loved by Dr. Estrella. The next day I came to work, we were eating. I never knew that dog meat is very sweet. We were eating, they're rejoicing, eating, And Dr. Strelas, we asked me, Rita, how do you see the food? I said, sir, delicious. Masarap naman. Masarap naman. This means it's so delicious and so delicious. After eating, Dr. Strelas told me that is that Douglas, the dog meat you ate. I said, you better don't vomit it. You better don't vomit it. I decided not to vomit it and swallow it because they are good at trigger. I was afraid. I thought it would kill. I decided not to vomit it and was shaking my head. That passed. He told me, you must be a scientist than a traditionalist or culturalist in studying psychology. And that will help you to manage your people and know when they are in such situation. We agreed. As I agreed, we keep on moving. When they talk of, I asked them, what are you people saying? And people will know that witch is disturbing, witches are disturbing. You don't tell me there is no witch. They are, and they're everywhere. One day, there was a bird crying on top of the tree. I told my boss that it is that very witch. My boss got a big light and shoot it to the tree. Oh, stop seeing. And he told me that it's a nocturnal animal. With light, it cannot see. And told the wife, needs to hold the light. And as she was holding the light, she stretched a ladder and went and cut the owl. And was rubbing the head of Yukupi. I was lost looking at rubbing the head of Yukupi and told me that in your English dictionary, you're supposed to know that it's called bed of good luck. But in Africa, you call it a witch. And truly, when I went to my dictionary, it was called bed of good luck. When it perched in your roof, it will be bed of good luck. I was rehabilitated in so many ways. When I came back to Nigeria, and we had a meeting, Professor Zoka decided to call back people in the meeting of clinical psychology. And I wrote something that is called spiritual attack syndrome. And when I went to present it in the meeting, people did not allow me to hear. I found out that some people are not rehabilitated yet, that I'm rehabilitated. I decided to keep quiet. And years later, somebody came to me. That book, you said something about spiritual attack syndrome. Now, spiritual attack syndrome is fading away. Mental disorder is no more what it was when I came back to Nigeria. Then, mental was mental, but now, mental is being somehow loving and more mild. Chief, and milder than it used to be. Now, lesson learned from my journey. One thing to take away here is the value of career counseling and mentorship for a productive education. The importance of career choice counseling and follow-up cannot be overemphasized in the post-secondary education. It is always good to fit vocational aptitude to vocational interest. It is a perfect combination. The essence of career testing and career and counseling was to identify students' vocational interest and match it with the vocational attitude. Postgraduate mentoring is the foundation for successful outcome. It is always important to find a good mentor with academic records. Mentor-mentee relationship should move beyond academic project writing and supervision to total personality shaping of the mentee. People should be able to see your mentee in you. It requires love, patience, understanding, obedience from both sides. My second section is on schizophrenia. Schizophrenia is not the only psychiatric disorder or emotional disorder, as I used to call it, that exists. That exists. Schizophrenia is not the only mental disorder, but people dread it a lot. People dread schizophrenia a lot. Schizophrenia is a psychiatric disorder that causes severe disturbance in perception, thinking, and behavior. It affects people irrespective of culture, race, and social status. Some colleagues used to refer to schizophrenia as the cancer of mental illness. Kraepelin, unlike Kraepelin, Bleuler thought it was possible for people with schizophrenia to recover. This I agree with, especially if treatment starts early. Sometimes people will log in their handset and come and tell me that my brother has schizophrenia. This person has schizophrenia. I will say which type. He has schizophrenia. But I'm sorry, it's high time people will start labeling and learn to consult the professionals that are custodian of diagnosis. We have undifferentiated type of schizophrenia. It's like a garbage box where you put everything. In undifferentiated type, a lot of symptoms of all schizophrenia is in this group. We have another paranoid type, the one that think you want to kill him or you want to harm him, and he will want to harm you. And if you don't take time, he will harm you. We have a catatonic schizophrenia. Catatonia is extremist. He may at one time become so much excited. At the other time, he will stay mute. Catatonic, as if he's not alive. But if you keep food for him here and go, and come back after some hours, he will eat the food. After eating the food, he will stay as if he's not the one that ate the food. And some people that he is able to deceive will say that evil spirit has come and taken the food, that he is still the way he was standing. But it is not true. He is the one that ate the food. Another is disorganized or Hebephrenics type. At this very point, this person is totally disorganized. Severe disintegration in the personality. The person is disorganized. And another one is the residual type, the milder form of schizophrenia that you will see when the person is coming into the full-blown case or active phase, or the one that is left after treatment, the residual type. Schizophrenia. Schizophrenia is a disorder that is really, symptoms and prevalence, that is really not very common. It is not common. DSM-5 diagnosed schizophrenia the way he finds. He talk of, in diagnosis, he talk of the delusion. Delusion is having false belief that is upheld in spite of every evidence contrary to the belief. Example, like my patient who will say that when he calls rice will land in the compound and I will carry and hide. My patient who will, on taking rice to cook from the bag, after taking the rice, he will return back without returning rice. Use hand to fill up the bag again. When the rice finishes, anxiety will catch him. It's like when Udude said, the picture will not appear. The picture we were taking will not. I said that is what we call magical thinking. People believing in magic. Magical thinking. Sometimes my patient will be in Obosi, calling somebody in Enugu with voice. I said, if that is the case, why do we have handsets? And why do we have loudspeaker? And he will be there. Mama! Bianego magusigo! midnight. Ma, stop calling. Your mother will not come. She's not hearing. I will call her with my handset. No. Mama! That was it. Ozago. That is hallucination and the other three hallucination. This is about 12 o'clock, 1 o'clock midnight. Onaza. Mommy, shall go onaza. Because delusion, false belief, that is not there. In spite of the contrary, you keep on reorganizing, keep on teaching, they refuse. Another disorganized in speech. They are disorganized in speech. And gross personality disorder. No more as neat as used to be. No more as kind as used to be. Person is disorganized. Poor emotional expression. You can't get the person you used to know. According to DSM-5, this will manifest itself, these symptoms, within 1 month ongoing. There is something I want to clear. Sometimes in our culture, you may say you hear something. Within 2 or 3 days, you forget it and you will be functioning again. But in the disorder itself, when you say you hear it, you will be in need for not less than 1 month. You will keep on, and it will, if you are in school, it will affect school life, church life, family life. It will metastasize. That delusion and hallucination will continue to be there. It's not just when somebody says something, you say, Kuro, no. There are things that are going to follow. Emotion, loving one another, being kind, and trying to show empathy. That's why they can, when they get angry, they can butcher you. They can bully you. They can deal with you. Mostly if it is a family member. As diminished, another point is diminished in original functioning. The previous functioning, that person you used to know, kind, good, well-dressed, is already disorganized and no more there. But one thing you will not see in schizophrenia is manic reaction, overreaction, and also depressive reaction. You will remove these two in order to diagnose schizophrenia. Schizophrenia may be quiet, but murmuring, hearing voice that is not there. Like a client I was talking to 2 days ago, I was asking him, why is it that you don't want to continue your education? Mommy, she wants to get the voice. She believes the voice here will tell her what to respond to me. I'm talking of why you don't want to go to school. Yes. I said, is there anything talking to you in your ear? She said she wants to get what to reply to me outside. But that is when we say that one is out of touch with reality. Because what you want to hear from your inside and you want to hear, you say it's coming from outside. And you don't hear it. I don't hear it. That person doesn't hear it. You are the only one hearing it. You are out of touch with reality. You don't know what reality concept is. As this continue, as this continue, schizophrenia, most of the time, people will ask if schizophrenia has a warning sign. A warning sign. How do we know that schizophrenia is coming? Schizophrenia has a warning sign. For most cases brought to us, parents will be complaining, this my child doesn't want trouble. This my child doesn't talk. This my child is a gentle person. This my child is easily controlled. Why is it that is this my child that this disorder befalls? But it is important to understand when your child supposes good virtue are masked for future psychopathology. Never you allow your child that is very quiet, that doesn't want trouble, to be doing that before you. It is even better in those days, our mothers will say, if you beat, you beat back. Teach them to assert self, because being good and being gentle is not so. It doesn't work. It doesn't work. Sometimes we women, we will say we will marry that man because he's quiet. Men will say we will marry that woman because he's quiet. You are trying to buy a market that you cannot manage. Because he's quiet, he's quiet. When the person comes out in the usual bottled up emotion, you may not like it. Ask people, let's do a research on people whose husbands are quiet, whose wives are quiet. They will tell you that they hear him way. Caregivers express worries. Mark diminish. Again. Some so, in schizophrenia, and saying that we have a symptoms that it has warning. Schizophrenia is a disorder that has warning. It has also premorbid personality. It has premorbid personality. Caregivers express worries on why this disorder affects children assumed to be quiet with non-reactive aggression tendency. Some personality disorder have been shown as strong predictor of schizophrenic disorder. Person with schizoid and schizotypal personality may progress to schizophrenia. When we talk of schizoid and schizotypal personality, it is when people are eccentric, when people are detached, when people socially, they are not that very good. You will be saying, no, that the brothers are all out. The sisters are all out. She's the only one that can stay and take care of you. High-level schizoid individual may be mistaken as quiet and gentle. That is not so. If you allow this very behavior to go on without correction, it will create a big problem. More schizoid, more of schizophrenic disorder comes up in adolescent behavior. During adolescence, when you have any child that is growing, that is in adolescence, and they are whining, they need your support. Baby them. Take it easy with them. Don't use force. Take it easy, because they may snap if you push them much. They may snap if you push them much. They are withdrawn. You will be saying, is it not this child that is so good, that is behaving this way? Why then this child is behaving this way? We talk of prevalence and burden. We talk of prevalence and burden. Schizophrenia is not much as we target. Schizophrenia can only come 3 out of 1,000, according to Sahar and co-workers. The incidence is very low. And oncoming of schizophrenia is insidious. It comes gradually. It doesn't come so much quick like that. In this world we are living with, schizophrenia is only 21 million out of billions of people in the world. Out of billions of people in the world, schizophrenia is only 21 million. Schizophrenia, in the diseases that are disabling, despite being low in prevalence disorder, schizophrenia ranked 12th most disabling disorder among 3 110 diseases and injuries globally. Schizophrenia is a disorder that needs to be diagnosed by professionals. Don't just get into saying it's schizophrenia. And you will not label your growing child, but you make sure you teach them lessons that will teach them something. In foreign, when people talk of foreign education, that word why, when, who, what, it's very important. You get answer. When I ask you why, without response, I will be moving. Who? Without response, I will be moving. When? Without, it's childish, undeveloped questioning. If I say what, I look at you to supply me answer. When? I expect an answer. But if not so, it doesn't work. Lessons from symptoms, prevalence, and burden. Schizophrenia is a burdensome disease. Schizophrenia is a burdensome disease. Let me tell you, a schizophrenia hurts family members so much. If you happen to open your mouth and say that your child is mentally ill, it's enough for that child to kill you. Families will be wondering, why is it that children are angry with the family? It is because of what you are saying. They may be murmuring, going about, mommy may be peeping, people may be wondering, may be looking, and the child will not be happy, thinking that you are saying that it's mental, because they know we are coming to that end. Schizophrenia lessons. Schizophrenia and other severe mental disorders are always insidious. They come gradually. It is always important to monitor children and adolescents for gradual change in mood, behavior, and seek expert consult as fast as possible. Good psychological assessment is the key to early diagnosis. Etiology, causes of mental disorder. In my discussing schizophrenia, I don't like calling organic this, organic this, organic this, but one thing I know, that it has been attached that mental disorder is part of it. Because schizophrenia is a complex disorder, so many theories and hypotheses have been proposed as to the causation of the disorder. One thing is clear, all the theories and hypotheses had significant impact on schizophrenia, making it a complex disorder as it regards causation. Mental disorder is that. A lot of mental disorder is that. But I don't like calling on mental disorder. It is in my handbook, and you will read it. I don't like calling it because of the way people approach me in the clinic and the way the patient himself feels about saying that it is a brain damage. Heritability. There is what is called familial clustering. There is what is called familial clustering. One you can see in different families, cousins. We will say that it is a sort of hereditary. It comes from family heritage. A study has gone on twins examination, studying twins that was moved to the calling twins that was moved to a family that is not schizophrenic type, and yet she developed there. and once that was changed to a family that it is not, and they developed there. I'm sorry. Stress is also part of the problems that contribute to schizophrenia. Schizophrenias have low tolerance of stress. Much stress can push them into a disorder. I will stop here. So far, major problem of schizophrenia is reasoning. They have problem with reasoning. Reasoning is part of the problems that trigger schizophrenia.
I don't believe that was a round of applause. May we be seated, please? I will just put a little anecdote before we continue. Sometimes you see skits on social media of people who you think are above something in the Nigerian parlance. And you see them saying things that are unintelligible, and we turn it into a joke. Like the person who said, we were where, and we laugh. The next person says something about transmission, omission, commission, transmission, and we laughed. The other time, I was an invitee to, very recently, I will not mention names, to a program, and I saw a professional MC, and I felt for him. The MC was messing up the whole thing. And inside my mind, I was saying, MC. What is the moral of all my schizophrenic perambulations? A man or the fella. So another round of applause for Professor Rita Ugokwe-Joseph. This is the time I will call on the chairman of the Inaugural Lecture Committee.
Hello, my dear. I still have things. Yes. I still have things that I want to, that is important to me. Yes. When we talk of problem of schizophrenia is reasoning. It's reasoning. It's reasoning. Problem of schizophrenia is more of reasoning and problem solving. When we talk of reasoning, and problem solving in schizophrenia, it is very, very important. In schizophrenia, the problem is not that they don't reason. They reason very well. But how to solve a problem is their problem. Example, there was a day I left and went to school, and my cook that was cooking went to look for kerosene, and kerosene was no more there. And she shouted and said, "Hey, mommy will kill me when she comes back." Do you know what she did to solve that problem? She went out and was staying in the street in front of a person selling kerosene without telling the person to give her kerosene. And on doing this, when I was coming back to school, I saw her sitting there. I was surprised. I said, "Is that not my cook sitting there?" And it was my cook. I went and asked her why. She said, "Mommy, kerosene, there is no more kerosene." I said, "Is that why you are sitting here?" She recognized, she reasoned out that the kerosene has finished. But solution to the problem is the problem. Solution to the problem is the problem. Schizophrenia, as we see them, reasons, they reason very well. I have many reasons to say that schizophrenia, that they reason very well. I have a client that went to graduate in Ebonyi State University. She did not graduate, but every time she would be saying that we are in problem solving, that we are with her certificate, that I'm working with her professorship. Dr. Val is working with her doctorate degree, that she owns that. But on discussion, we will find out that she knows very well. On transactional analysis, on psychoanalysis, she will also tell us that she's frustrated, that she was stopped in second year. If only we can take her back to Ebonyi State to graduate, that her problem would be over. She reasons, but the fact is that she doesn't know how to solve the problems. Magical thinking is most of the problems that we have. And when you listen to the schizophrenics, they know there is meaning in whatever they are saying. If you don't understand them, you won't know they are meaning in what they are saying. One is saying kwakeja, that if anybody misbehave in the world, we will call kwakeja to deal with that person. Kwakeja is a disciplinarian in their village. But if you start looking for kwakeja, you will say that she doesn't know what she's saying. Another name she used to call me is Nwazojie. Whenever I'm coming back, Nwazojie is coming back. Nwazojie is coming back. Nwazojie is a good healer that she knows in their village. So many. Nwazojie is a good healer she knows in their village. The problem of schizophrenia is to guide schizophrenia on how to solve their problem. Therapists must aim at improving the difficulty in problem solving. The outcome of therapy depends primarily on the extent to which the therapist managed to achieve consistent improvement in the patient's mental functioning by improving his or her problem-solving capacity in a day-to-day interaction. Capacity to solve problem in adaptive and healthy way is a Hello. Schizophrenia and insight. Schizophrenia has total insight into their behavior. All schizophrenia, they have insight, but the only problem is solving the problem. I have Chinagorom. Chinagorom came new and was disturbing the world. And when I approached Chinagorom said, okay, man, you know I'm new. I've not stayed as long as this people. You better give me a chance to improve so that I will stop disturbing. Most of my patients on discussion, on interaction, I know they have their problem. I know they have their problems and they can solve the problem. So in insight, schizophrenia has total insight into their problem. Another thing is work life. Schizophrenia has no capacity to work. Whenever you give them something to do as work, schizophrenia will mess it up and will not work it well. And it is not good to employ them. Most of the time, family will be saying, employ the child to work with you after treatment so that I will not pay. But in employing the child to work with you, it is a big problem. The child cannot work. They have difficulty in working. They have difficulty in working. Lesson in working, severe mentally ill patients can always benefit from occupational therapy and social skill training. Look for all-compassing treatments. Schizophrenia and aggression. Schizophrenia and religious aggression. Schizophrenia can easily destroy religious properties. It then means that they don't know what it is to be believing in the Christ. They can destroy the religious article. There was a day one jump up in our reception and destroyed the cross that was there. Immediately he destroyed the cross. He turned back and said that he has committed unpardonable sin. What are we going to do now? He realized it, that he destroyed. And schizophrenia and family relation. Schizophrenia doesn't agree with family at all. Family is a serious enemy to schizophrenia. If you don't take time and remove them out of home, they will hurt you. The best thing for place for schizophrenia is to take schizophrenia to rehab center. Schizophrenia and therapeutic relationship. A therapist has to be empathical, has to be kind, empathical, and considerate in dealing with schizophrenia. If you don't deal with schizophrenia with love and kindness, you are not going anywhere. You are not going anywhere. Let me stop here. It's schizophrenia is a funny disorder and a disorder that you will love to be with. They don't give problem. They love us. But the only thing is for you to know how to deal with them. Thank you very much.
Thank you, thank you, thank you, thank you, thank you. Because thank you, Prof. Thank you, Prof. Okay. Let's quickly. Yes, I'm calling on. They will be seated, please. Please, let's sit. Mr. Vice Chancellor, sir, as you have risen, please kindly come up with the inaugural lecturer and the chairman for the decoration. Immediately after that, we take vote of thanks by the chairman, by the vice chairman of the committee, Professor Ezenwa. VC, sir. Son of Ugokwe. Camera, this is the time. Professor Rita, please, for your decoration. I met a schizophrenics, and the Mandanano Henantia, the Sinantia Guaha.
Mr. Vice Chancellor, sir, I confirm that Professor Rita Ugokwe-Joseph has delivered the 66th Inaugural Lecture of Nnamdi Azikiwe University, Awka. I kindly request you, sir, in the presence of this audience and the virtual, to decorate and recognize her as the 66th Inaugural Lecturer, Nnamdi Azikiwe University, Awka. Mr. Vice Chancellor, sir.
Thank you very much. First, I will say congratulations to Professor Rita Ugokwe-Joseph for a well-delivered inaugural lecture. And on behalf of Senate, on behalf of Council and Congregation of our great university, Nnamdi Azikiwe University, it is my pleasure and singular honor to publicly decorate Professor Rita Ugokwe-Joseph for successfully delivering the 66th inaugural lecture of our great university, Nnamdi Azikiwe University. Congratulations, my dear sister.
Thank you very much. Before I call on Professor Zengwa to give us vote of thanks, may I quickly recognize the presence of Ms. Nkoli Obiayon. Please round of applause for her. I saw her. I could also see the DR Senate. Ukoisi, we see you. And of course, Professor Godson Okafo. Thank you very much. Quickly, this cake thing, who and who is involved? Because VC in Apo Apoketa, who and who is involved? Okay, vote of thanks, right? All right. Vote of thanks quickly.
Thank you very much. Mr. Vice Chancellor, members of the audience. Let's first appreciate our VC for consistency in his appearance during these inaugural lectures all the while, particularly that of today. May I also, on behalf of the Inaugural Lecture Committee, appreciate all the guests here, both those that have joined virtually and those who are physically here. We thank you very much for coming. And I'm sure that you must have learned one thing or the other about schizophrenia and schizophrenics. One thing we have learned, at least, is to show them love, not to be afraid of them. The inaugural lecturer has been a very big practitioner. In fact, I shared one experience with her. One story she told me. It was in Onitsha, near the main market. She had a boss, and then there was a lady, a vagrant. I said, people were afraid of the woman and so on. And then she went to the woman, people were looking at her, and she quietly spoke to the woman. A vagrant collected the dress and covered her nakedness. And not only that, according to her, she followed her into her bus, where she took her to the center for rehabilitation. Another experience, this one is very interesting. One day she had an exam very early under one of the previous vice chancellors, and she had a punctured tire, so she was late to the exam. And the vice chancellor was monitoring and came and saw her students outside. They said, "What's happening?" So they said they were waiting for the lecturer, but she had called to explain her situation. That vice chancellor took over the list to call in the students. So the time she drove in, she had a lot of anxiety. She didn't know what to do. And the VC was at the door there, calling in the students. She just reasoned what to do. After a while, she just murmured, You know, if she were to be your wife, who asks what happened that she came late, being a very unusual behavior. And that vice chancellor just dropped the scripts and left the hall. Then she had access to her students. So, for want of time, I want to thank all of you, the chairman of the Inaugural Lecture Committee, my teacher, Professor Nweke. She taught me from year one in the university, in this university. I want to thank all of you. And for want of time, please, we need to know that the next inaugural lecturer is going to be Professor Ada Omeni on the 16th of December. Keep a date with us, and I have the privilege to invite Reverend Father Ajolo for a closing prayer, and thereafter we'll recess very quickly. Thank you.
Thank you. Quickly before Reverend Father Syracuse Ajolo comes up, may I recognize the presence of the Sub-Dean of the Faculty of Social Sciences, Dr. Tochukwu Ogoegbe Anyifo. Again, no. Deputy Director GS, Dr. GS Enekwe, no. Oh, yeah, we can see you. Please, do we do the cake thing now? Okay. Father, please. After the prayer, the anthem, that's the tradition, then recession. We can still do the cake thing, but the VC is in a hurry.
May we stand, please. In the name of the Father, and of the Son, and of the Holy Spirit. God, you are the author of wisdom, and we are here for the sake of wisdom, for the sake of knowledge, and we today listen to your handmaid, Professor Ugokwe-Joseph, that has delivered her inaugural lecture. Father, we thank you for her and what she has contributed to knowledge. We thank you, Father, for this university, especially our dear and amiable Vice Chancellor, who has been wonderfully a father to this institution. We ask God to bless him so that all his plan for this university will come to reality. Father, we ask you for all the university staff, our professors, and all those that have come today to listen to the voice of wisdom, that what we have learned today about schizophrenia will help us to help those who have this problem, so that at the end, all will be for the greater glory of your name, and we will be happy, and we will be with you forever and ever through Christ our Lord. In the name of the Father, and the Son, and the Holy Spirit.
University song, please.
Till we see rise of the strength and our mission, fountain of knowledge and of wisdom, source of our hope and confidence, where freedom through education began. With reverence we honor you. Our unity, then we learn discipline, self-reliance, and excellence. Grace unity, we dwell
Thank you. The Vice Chancellor, recession, followed by the inaugural presenter, and yes, the chairman of the committee, other inaugural presenters. I know. This is the tradition. The recession must take place. They will now come back and use our sweet mouth for the cake. Let us not forget there is a cake here. And let us whet our appetite for Professor Adasamo Omeni's presentation on the 16th of December. Thank you.